this is a great discussion, and I have to say that the fundamental point in this discussion should not be lost on anybody in this chamber or on the American people. And that is, whatever was said during the course of the campaign last year was said in the context of protecting and preserving and prolonging the lifespan of Medicare. Senator McCain is very accurate in the way that he describes his position here. But what the American people need to understand, what the other side is proposing, a $2.5 trillion expansion of the federal government financed with $500 billion in Medicare cuts in the first 10 years, and as the senator from New Hampshire said, $3 trillion in the first 2 decades of this program, does nothing to extend the lifespan of Medicare by 1 day. Nothing. What it does is it creates an entirely new entitlement program that's going to be paid for by future generations of Americans. And so Medicare, which is destined to be bankrupt by 2017, is sitting out there floundering with this huge unfunded liability. It's going bankrupt. And what we're talking about doing is piling a $2.5 trillion new entitlement program on top of that. That's what this debate is about. Now, they can say these Medicare cuts aren't real, but you have 11 million people in this country who get Medicare Advantage benefits, and if there's going to be a $118 billion cut, somebody's going to feel some pain. Surely you jest when you say that these cuts aren't going to hurt anybody. Hospitals, home health agencies, $15 billion out of nursing homes. You know, in the state of South Dakota, home health care agencies, like they do in Montana, provide services to people in rural areas. Some people have to go 50 or 60 miles to see a home health, or to have somebody come and serve them, a home health care specialist. What you're talking about doing is cutting in my state $35 million out of home health care. These cuts are $500 billion. Of course somebody gets hurt by that. But what's probably most troubling of all, I guess, about the whole proposal that the other side has made is that after all that, cutting Medicare, raising taxes, at the end of the day, 90% of the people in this country either have their health insurance premiums stay the same or go up. Over 6% if you're in the large employer, or in the small employer market, 5% if you're in the large employer market. Double the rate of inflation. That doesn't change anything. If you're a family today and you're paying $13,000 for health care insurance, this is according to the Congressional Budget Office. In 2016, you will be paying over $20,000 a year for health insurance. That's a $7,000 increase. Now tell me how that reforms or helps anybody in this country. And I want to show you how far we've come, because the president said in 2007, when he was campaigning, when I become president, we will have a health care reform bill that reduces premiums for people in this country by $2,500 per family and covers everybody. We all know this bill leaves 24 million people uncovered, according to the Congressional Budget Office, raises premiums by 10 to 13% for everybody who buys in the individual marketplace, and keeps them the same, and that is, when I say the same, yearly increases of 5 to 6% year over year for this foreseeable future for everybody else. The best you can hope for, America, 90% of America, is the status quo. The best you can hope for under this. How does that change the status quo? How is that reform? You can call this an overhaul. You can call this a takeover. You can call it lots of things, but it's not reform. Because when the American people think about reform, they're thinking about something that drives their health care costs down, not up. The Congressional Budget Office has said that under this bill, health care costs in this country will go up by $160 billion over the first 10 years, not down. If you're 90% of Americans, you stay the same, or your premiums, at worst, go up by 10 to 13%. That's according to the Congressional Budget Office. So, Madam President, I want to point out how far this debate has evolved from what the goals were in the first place. And I have some other comments that some of my colleagues have made. Senator Stabenow, high health care costs are causing cuts in benefits and increases in premiums, adding to the ranks of the uninsured at alarming rates. But the impact of this problem goes beyond individual families. Skyrocketing health care costs make our businesses less competitive in the global marketplace and cost us good-paying jobs. This is about jobs. And this proposal does nothing to help small businesses create jobs. It kills jobs, and that's why the National Federation of Independent Business, the Chamber of Commerce, National Association of Wholesalers and Distributors, all the major business organizations are opposed to this legislation because they know the impact it will have on jobs. And I want to read one final quote, Madam President, and this doesn't come from a business organization. This comes from the dean of the Harvard Medical School. This was in an op-ed just recently in the in the Wall Street Journal. Speeches and news reports can lead you to believe that proposed congressional legislation would tackle the problems of cost, access, and quality, but that's not true. The overall effort will fail to qualify as reform. In discussions with dozens of healthcare leaders and economists, I find near unanimity of opinion that whatever its shape, the final legislation that will emerge from Congress will markedly accelerate national health care spending rather than restrain it. That's from the dean of the Harvard Medical School. He goes on to say this will make an eventual solution even more difficult. And so, Madam President, these Medicare cuts are real. They're $500 billion in the first 10 years. As the senator from New Hampshire has said, $3 trillion over the first 2 decades. Cuts Medicare Advantage. There are seniors, 11 million seniors in this country who get Medicare Advantage, so don't say that they're not going to get hurt. Their benefits are going to go down. Of course they're going to get hurt. Home health agencies, nursing homes, hospices. As I said, in my state of South Dakota, home health care delivery will feel an impact of $35 million in an area of the country where we have vast distances in geography and where we already have home health agencies closing up shop because the reimbursements don't keep up with the cost, particularly when you have to travel the distances we do in our state. And if you have to put them into a hospital, the costs go up by multiples. So much more efficient to have somebody served in a home health setting than to have them overnight stay at a hospital or successive overnight stays in hospitals. And so, Madam President, this is not reform. This actually drives up costs for 90% of, or keeps the same or drives up costs for 90% of Americans. It does cut Medicare, and it does nothing to preserve the lifespan.
Minority time has expired.
I yield the floor.